Are you frustrated trying to get your Wegovy or Zepbound covered? And do you feel that insurance is stopping you from getting your weight loss medication? Well, today's episode is for you. We are talking about how you can navigate the insurances to get your weight loss medication covered. This is a huge problem for a lot of my patients. In fact, it is the rate limiting step, meaning that if we can't overcome this insurance, then the patient is left with paying hundreds and thousands of dollars for this medication. And sometimes people can't pay that. It's not in the budget. And so today I wanted to maybe share with you just a couple of strategies on how you can overcome this hurdle. But first, before we get started, let's kind of talk a little bit about what these medications are. So we have that's FDA approved for weight loss, we have Wegovy, which is a once weekly injection that helps with not only curbing your appetite, it also regulates how many calories you're getting into. I have some patients who say that it actually kind of takes away the food noise for them, so they're not thinking about it. And then we also have Zepbound. The difference between Zepbound and Wegovy is that Zepbound kind of targets two hormones that help with regulating appetite and reducing how much your portion control, reducing how much you eat, whereas Wegovy targets one. That's the difference. But they're both once weekly injections. They're also fairly new. Wegovy came out in 2022. Zepbound came out in 2023. So they are fairly new, and which makes it a little bit more difficult, for insurance to cover. And in history, normally insurances do take some time for them to cover certain medications. Although I will say that for both, it is covered by a lot of insurances. But we do want to talk about where the backlog is and what I'm seeing. So the reason why these medications are helpful is that when we look at the amount of weight loss that people are getting in the past, it was normal for people to lose 5 to 10%, and we were happy. But with these medications, now you're getting closer to 15 to 20%. And so it really makes a big difference in somebody who's trying to lose weight. Also, Wegovy has been approved, FDA approved, to help individuals who have a pre-existing condition of heart disease or heart failure, heart attack, congestive heart failure, and stroke. It has been shown to reduce your risk of dying from a non-fatal stroke or non-fatal MI by 20%, which is very significant. It's the reason why we ask people who've had these conditions to be on a statin, because a statin cholesterol medication, because this medication has been shown to reduce your risk of mortality by 20% as well. So with that being said, these are very important. These medications can help people with not only losing weight, but changing their life trajectory and their health, most importantly. But the question is, how do we get it covered? Because that's the bane of my existence. So let's just talk about the different people who are candidates. Now, a lot of times I do ask my patient to call. So it's important that you do some groundwork first. So you do need to either call your insurance, or sometimes they have a website where you can go and just kind of put the medication Wegovy, Zepbound in their search to see how much it will cover. And when you call the insurance customer service, and I will say that customer service people are very nice, but they're not really clinical. I used to work in customer service, and a lot of times you have a script that you go through to help the patient, but you may not necessarily have all the knowledge of what the medications do. You just have a list of what's covered and what's not. And so sometimes what my patients will do is that they'll call and the insurance will say, oh, well, we don't cover Wegovy or Zepbound, but we cover Ozempic and Mounjaro with a prior authorization. Now, I do want to say there is a difference between Ozempic and Mounjaro and Wegovy and Zepbound. The difference is this. Ozempic and Mounjaro are FDA approved for type 2 diabetes. So that means you have to have type 2 diabetes. And some insurances are really strict. Not only do you have to have type 2 diabetes, they may say, hey, you have to have tried metformin. Or, hey, you need to have an A1C that's greater, a hemoglobin A1C, which is a 3-month test that tells you the average of your blood sugars. But that test has to be over a certain level. Definitely over 6.5, but I've had one insurance say they have to be over 8.5 before they were even covered. So these are extremely important because, first of all, the customer service doesn't tell you that. And so when you go back to your doctor and say, well, hey, Wegovy and Zepbound's not covered, but Ozempic and Mounjaro is, and it just needs a prior authorization. When the physician does the prior authorization, what happens is that they have to answer these questions. And the question is, does the person have type 2 diabetes? If the answer is no, you instantly get denied. Or if they said, Does the patient have type 2 diabetes? The answer is yes. And has the patient tried metformin? And the answer is no, then you may get denied. Or if if we have to send in your blood work and it doesn't show an A1C at a certain amount, then you can get denied too. So it can be very frustrating for patients because you have this false hope. You're like, oh, well, it's not covered by, these two aren't covered, but this is, and maybe this prior authorization that my doctor has to fill out will just open the door. But in actuality, that prior authorization is a way how the insurance is kind of closes the door because you have to meet their certain criteria. And this particular criteria is not on that customer services, they don't have access to that criteria. So they can't tell you what to expect. So, which once again, it's more time and frustration on the patient. So the first thing I would say to the insurance. So the first thing I would do is, number one, if you're interested in starting any of these medications, call your insurance first. Call them, talk to them. If they say Wegovy and Zepbound are excluded, then what that signals is that your insurance does not cover weight loss medications, period. And the reason why your insurance does not cover weight loss medication, period, is because your employer has to opt in to covering weight loss medication. So when your employer actually signs up for benefits for its employees, it has to say or check yes or no whether it includes weight loss medication. And due to it being an additional cost, some employers don't cover it. So it's not, regardless, it doesn't even matter the insurance. It's more of the employer where the issue is. And in that case, you do want to talk to your human resources to lobby them, to get your fellow, employees to say, hey, we want these medications covered as part of our benefits. This is important to us because your insurance will only do what the employee or their client wants. And so if you're finding that your employer is not covering it, then you need to lobby your employer. Now, granted, we may not all of us work with a union, but if you work with a union, then you need to bring that up so that they can negotiate that when it's time to negotiate the contracts with the union. Also, hey, you never know by you getting more, because there may be other people who would love to be on medications for weight, but the employer is not opt-in. So they may be willing to sign a petition or going themselves and saying, hey, can you all include this for next year? Open enrollment is coming up in these next couple of months for many companies. And so it's important that you lobby them and see if they may be willing to do it. I know in our institution, we're so blessed that they have been able to cover it, but that's taken a lot of people lobbying and asking and pestering. You know what they say, the squeaky wheel gets the oil. And so in order to see a change, sometimes you have to be that change maker and lobby them. Also, for those individuals who are on Medicare or Medicaid, you may have to lobby your congressperson, the people who you vote for, because in order to see if they can get covered. There is an act on the floor of Congress called the TROA Act, TROA. It's called Treat and Reduce Obesity Act. It's been brought up multiple Congresses. It's in Congress currently. And if you look, you can actually just Google TROA.com or Treat and Reduce Obesity Act. And you'll be able to, or even go to the website Obesity Action Coalition, and you can actually search for who your Congress people are, and they give you a script or a letter that you can email to them, or a script if you call them, so they can support this act and this bill, so that hopefully, millions of people who are on Medicare, not just people who are over the age of 65, but people who are on disability, they'll be able to get access to these medications. Because like I said before, these medications are not just to look better. These medications are improving people's medical health, medical complications. I had a patient tell me, she said, why is it that my insurance wants me to get diabetes first before they cover medication that can help treat my weight, which will reduce my risk of diabetes? It makes no sense to me either. But the only thing I can think of is it money, but still, it doesn't make sense. And so if we can right this wrong and if we can kind of help people with controlling their weight, which will improve their heart outcomes, their high blood pressure, their diabetes. Actually, by reducing your weight, it can reduce your risk of cancer. Having obesity increases your risk of cancer by 40% in the breast and your estrogen-related cancers like breast, ovarian, and uterine cancers. So it makes a difference with what you can do by controlling one's weight. So I'm sorry, I get off on my soapbox, but I'm just saying we have work to do. We have work to do. And we can be able to try to make that difference, and not just a change for yourself, but a change for your fellow employees. by either, number one, petitioning your human resources if they don't cover or they exclude weight loss medication in their plan. If you're on Medicare or Medicaid, actually going to your Congress people or your representatives and saying, state representatives, and saying that, hey, this needs to be covered. And know there's resources that to give you the words to say, to give you the script to say if you were to call them, or the words to write if you were to email them. And that go to Obesity Action Coalition. They'll be able to lead you along that way. So with that being said, the next step is, okay, so let's say the doctor has submitted the medication to the pharmacy. What happens is, once if it does require prior authorization, the pharmacy will send a request for prior authorization to the doctor. Now, it depends on the pharmacy. Normally, they do it through a system called Cover My Meds, or a different system called SureScripts, where the doctors can go in, or the doctor's office can go in and submit the information. That's the easiest because it's electronic and it's easy to kind of upload documents to that if you need to, like, send them your hemoglobin A1C or whatever else is needed to try to get it approved. And so once that's done, then the insurance will either come back with approved or denied. Now, it may be conditional, where it may be, hey, no, we need to add more documentations. We need your progress note. So it is important that when you go see your doctor to get this prescription, that they're kind of writing down all your complications, the prior weight loss programs that you've tried, kind of in their progress note, because if they do ask for it, then you can send it in and send that into the insurance, and they can read it and say, okay, this patient has tried these different many medications in the past for weight. It hasn't worked. She has been on, a exercise physician assistant weight loss program, and it hasn't worked. And so maybe this can kind of help put you into the field of saying, okay, let's approve it. But it's just important to have it because you just never know. The other thing I would say is also, too, once the doctor's office does the prior authorization, it says either approved, then you're fine, you get the medication. If it says you're denied, then the next thing that happens is that they actually will give you an option to appeal the denial. And so everyone is different, but usually you have like 30 to 90 days to appeal. And so usually you can appeal by writing a letter. Now, the one thing I would say, you kind of want to get all the verbiage in. There are different templates online. So you can just say, appeal letter for Wegovy template, and you'll see some templates that pop up that you can kind of use to kind of put your information and your passion on why it's there. Also, sometimes when I do my appeal letters, I like to put the studies, like, hey, this study says this will be helpful and this is why this person should be on this medication. I have to admit, the approval rate is a little bit lower. It's like, I think it said around 33, 34% on whether they approve an appeal letter, but you never know where you'll be in that percentage. And so it's better to do it and to get denied than to not do it and you could have gotten approved. So, make sure you're kind of writing that appeal letter. Also, it's okay if you want your doctor to do an appeal letter, you can say, hey, here's a template that you can utilize for the appeal letter. They actually will be very happy because you know what? The doctors are very busy. There's always something going on. And so to have like something where they can kind of craft it in their own language may be helpful, just depending on your doctor. Some doctors are very open to it because it just kind of helps them to not have to, think of a new letter. They can just be able to utilize that template and be able to get all the information across that you may need. And then secondly, once you have that, you just kind of wait and see, and we'll see if they approve it or deny. So I know this is a lot of the process, but I hope you're able to get some of this. Just to recap. So the first step, before you see your doctor, check your insurance, call them, use their website to find out, are these weight loss medications covered? If they're not covered, then you may need to go to your human resources to see if they can start covering these medications. Or if they just need a prior authorization, you can make sure when you see your doctor that you give them all the information they need as far as your weight loss history, what medications you've tried. And not only do they want what medications you tried, they also want the dates. So if you can write that down, the dates of when you tried your medication, that will be extremely helpful. So they can put that in the prior authorization. The one thing that sometimes these prior authorizations do get denied is because the doctor's office didn't have everything. They didn't see that you were on phentermine and Contrave and Glycemia prior to, you starting trying to get Wegovy. And so they're just using the information that's in front of them. So it's important to make sure your doctor knows that, and then that's in the note, and they can add that to the prior authorization. Once the prior authorization comes back, if it's approved, you get your medication. If it's denied, then you get an opportunity to write an appeal letter to see if it can get appealed. You can get templates online on how to appeal it. Also, you can, also give your doctor a sample letter that they can utilize for them to do it. Sometimes, depending on how busy they are, they may actually just copy and paste and put the relevant information in it, and that at least help you that they know which information they need versus them saying, this patient needs this medication and here's my signature. So I hope this helped. The other thing I would say, it is important to advocate for yourself, advocate for your fellow employees. If you need to, if you're on Medicare or Medicaid, advocate at the level of your state government and also your federal government, so that we can get more people covered. Because not only we're seeing really great results where people are not only losing weight, but their health complications are improving. And that will help us, that help people down the long run to live happier, healthier lives because of the fact that their weight's controlled. I thank you again for listening to today's episode. If you have any questions, any topics you want me to cover, please feel free to leave that in the comments. I'll be happy to create a episode just for you. And I look forward to seeing you all next week, again, on the Back on Track Achieving Healthy Weight Loss podcast. All right, guys, have a great rest of your day. And don't forget to like and subscribe and share with others. See you next time.